women's health is so complicated. Women are complicated. Our bodies are complicated. The care delivery is complicated. Changing policy is
Yeah.
complicated. Speaking to the many different constituents who will be impacted by the
Yeah.
choices that are made is complicated.
Not only that, Rachel, but if I hear literally every day, why isn't there enough research in women's health? And now we actually have, well, actually, we've had for 30 years an organization that's really working to improve this and try to eliminate that gender disparity in research in healthcare.
So we are so excited for you to take a listen to Katie Schubert, who's the CEO of the Society for Women's Health Research, and the complex issues she and her organization are tackling and the progress that they're making. So take a listen.
Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun-Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so delighted to welcome Katie Schubert, who served as the president and CEO of the Society for Women's Health Research, known as SWHR, since April 2020. Katie, like so many of our guests, brings this wealth of experience that makes her particularly well suited for the work. Thank you so much for joining us. Welcome.
Thanks so much for having me. I'm delighted to be here.
So you have a really interesting background, and we'd love to learn more about it. And you've done advocacy work, you've done work on the Hill. Talk about how all these things have come together to put you in the role you're in right now.
Yeah. So it's interesting to me that people think that it's interesting only because you always think like the experience that you've had people know or it may not feel like it's that big of a deal. And in DC, and I think this is true of most places, a lot of the sort of things I've chosen to do haven't necessarily been a choice. I sort of fell into it, or it, felt like it was meant to be, if you will. But I started my career on Capitol Hill working for my member of Congress. I didn't have any political connections. I just happened to be a constituent of hers and interned for her. And she happened to be the health subcommittee chair for the Ways and Means
Oh.
Committee. So health was not actually even an interest at all for me. I wasn't sure what policy area I wanted to be in. I just wanted to help people. And so I worked for her for a few years. She lost her election. I worked for another member of Congress who lost his reelection. And so I had to find another job and found myself at a lobbying firm, a very small lobbying firm, doing healthcare policy for nonprofits specifically, and mostly in the medical professional field and patient advocacy organizations. And one of my clients was the Society for Maternal Fetal Medicine. And I was really intrigued and interested in maternal health policy, probably because was having my children then. And I also knew many women who were either struggling with their fertility or having poor outcomes. And I could really see, doing policy here in DC would actually make a difference. And I also just really liked them. They're all wonderful humans. So I ended up going over to the Society for Maternal Fetal Medicine in-house as their lobbyist. And then sort of through that process, was thinking about, well, what do I want to do next in the nonprofit space? I would love to eventually become a CEO. But in the field of women's health, like I didn't want to leave this area and happened to come upon the Society for Women's Health Research, which I knew about and has been around since 1990 and was such a powerhouse in DC. And I was lucky enough to get that job. And so here I am. This is what we're doing now. But my background really is policy and advocacy.
Excellent. Great to have you. I'm just curious, number one, what is like the broad mission at the Research Society? But More than that, I really was perusing the areas of interest in women's health, and I'm just so curious, how do you choose what you choose? Because number one, there's so many things of interest, but like lupus is the one that really struck me because that's not necessarily on the top of people's minds now in women's health when all we seem to be talking about is menopause. So yeah, just fill me in on how you choose what's most
And what
pressing.
the overarching mission is of the Society for Women's Health Research.
Yeah. And I can start there. And we were initially founded to advocate for the inclusion of women in clinical research. And so worked really hard to do that. And then we also have these scientific programs where we bring these interdisciplinary experts together. But our mission is to advance women's health through science, policy, and education while promoting research on sex differences. It's very broad. Our vision is to make women's health mainstream. Actually, my
Mhm.
sweatshirt says that today.
How appropriate.
So yeah, I know, right? But I think we are very broad, right? We really look at anything that differently, disproportionately, or uniquely impacts women. And that is literally everything in terms of health and well-being. And at the time of our founding, we were really clear that we weren't going to do the bikini medicine work because that was being taken up by so many people. And we really wanted to look at these underfunded, understudied areas. And we do work in gynecologic health now. And, we do a ton in endometriosis and uterine fibroids, fertility, all the way through. But I think you're right. Menopause is having a moment, which is really interesting and wonderful because it is such an area of need. And we sort of think of it as healthy aging and this inflection point when we think about chronic conditions. When we were creating our research agenda, we wanted to find areas that reflected that different, disproportionate, and specific piece. So that's sort of how we came up with autoimmune being sort of like an
Mhm.
overarching umbrella, and that disproportionately impacts women. So 80% of autoimmune patients are women. And within that space, because there's 100 or more autoimmune diseases and conditions, we felt that lupus was one that was understudied, underfunded, disproportionate impact on women, yes, and women of color. And yet we did not know enough. So we sort of felt like it was a condition that people probably had heard of, although don't know enough, and that we could sort of raise awareness. We also have we had a program in lupus specifically. We had a toolkit related to that. And so we kind of were looking for areas that we had already been in and had our network, already sort of suited for. But I think it's really looking at impact. And I would say too, we can think of anything as a women's health issue. It's a matter of how we frame it
It's a
and
gift, right?
right? Yeah, right. That may be my lobbying background. No, but it really truly is. And so when we think about our programming and sort of impact and what that looks like, even if it's in a space like lupus, where there are lupus organizations, great, wonderful national organizations, we always go into those conversations asking what's missing and where is our voice most needed. So we don't want to recreate the wheel. We
Sure.
don't want to take over a space. And, this is sort of how we approached our fibroids work and
Mhm.
endometriosis, maternal health. It took a long time for us to get into that just because there were so many groups working on it and we didn't feel like, we would be adding, we'll amplify, we'll support. But we really want to make sure that what we're doing is meaningful and in a space where our voice and our network and the need is really there. And then, of course, like, what is the state of the research? What is the state of the science? Do we need to advocate for more?
Makes sense. One thing that I didn't notice, but I was wondering if it falls down on your docket, would be all of the environmental contaminants, toxins, chemicals that are specifically impacting women's health. And I'm sure they impact men's health as well, but I digress. So, is this something that you think you would, focus on in future? I find that I'm just, maybe it's generational, and so many younger women in my practice on a clinical level are asking about this and really making very conscious decisions about their hygiene product choices, their menstrual health product choices. What's your point of view on this, and how might you get involved?
Yeah, I think as we're learning more and hearing more and really thinking about what is it that women care about and value, we have to be talking about this, right? We
Yeah.
have to be in this space. And so while we haven't, I think the extent to sort of our historical engagement on this conversation has really been more geared toward personal care products or cosmetics, which sounds really surface level. It's not, it's
Mm-mm.
very serious, right? And when you think about even when we were all switching from our plastic water bottles to BPA free or glass, like that
Yes.
has always been a common thread. And I think just given the level of awareness right now publicly about the impact on health and well-being, A, there's a huge need for additional research in this space. And B, it comes up quite often in particular conditions because people are thinking about how they manage their health through some of these other choices that are beyond just, medication or, that we're looking at
Yeah.
lifestyle, we're looking at where you live. And so while we don't have a dedicated program right now in that space, there's a common thread throughout all of our programs. And I do think we're going to see more about it. We're certainly seeing conversation about it. This is a question, it just came up actually last night when I was at doing a fireside chat. It does come up when we're doing policy on the Hill. We're about to celebrate the Office of Research on Women's Health. And I'm sure that this issue is going to come up. We see this administration in particular cares very deeply about this. And so I think there's just more to come there. And again, like I think for us, our role really is, okay, let's sound the alarm on the need to fully understand what's going on.
So I have two questions. I have a number of questions, but one question is, who funds you? How do you do all the good work that you're doing?
Yes, great question. We get this one a lot as well. So we sort of have three buckets. We have our annual dinner, which is, happens every
Yeah.
year. Which I guess I should shout out, April 16th is this year. So those are individuals or companies or organizations who wish to support our work. We also have a policy council, and that's usually larger companies, quite frankly,
Yeah.
and trade associations, nonprofits that are able to come in and help us think about where we want to be on our policy agenda. It's also a good opportunity for us to get feedback from them on issues that we might be missing, boots on the ground. Our programming itself is largely funded through pharma, and we do have a very strict firewall. So, if they're interested in something like lupus or Alzheimer's disease, we create the program, all have editorial control. But it is limiting, right? And we see that often in many groups because it's a limited amount of funding. We do not have a membership.
Mhm.
We work for everybody. And so we're trying to figure out ways to diversify and make sure we're sustainable because we've been around for 35 years. There's still more work to be done.
A
And we
lot more
want to make
work.
sure,
Yeah.
yeah, and a lot of work in areas that we either haven't been in or are overarching, which is tough, quite frankly, to fund things like mental health across the lifespan, right? Like we're able to touch on it within our programming depending on what the health topic is, but there's such a need for that related to just like being a woman, right?
Right.
If you're caregiving, we're seeing disproportionate numbers when it comes to things like major depressive disorder. Obviously, postpartum depression is a huge issue. So, addiction, I mean, there's like, we could go on and on,
Right.
but I think there are things
This
like
is the
that we'd
optimistic
love to
part of
be
the
able to do.
conversation.
Yeah, 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 right.
Here's today's hot flash. In November of 2025, the FDA removed the black box warning on not only local vaginal estrogen, but on systemic estrogen products as well.
So when you talked about there's so much work to be done, and you're doing such amazing work, and you've been doing it for decades. You talked about impact. What are some of the metrics you're using to measure impact? Because some of this stuff is soft, but you ultimately have to communicate to your funders and your supporters that you're actually making progress on the issues that you've identified as important.
Yeah, I think that's a great question. As someone who advised organizations, particularly on the policy front, when there are so many things that are outside of your control in that environment, right? Like I would never we got a piece of legislation signed into law as a metric because there's just so many factors that go along with it. So the way that we're measuring impact, there are a few things. Number one, we've been able to make sure that women's health research at the federal level has increased funding funding year over year. We were able to work with the White House on a large scale women's health research initiative, which is still going. And we're working with Congress and the current administration to make sure that the priorities that are in there, looking at sex differences, things like that, the funding levels can continue. So we'll make sure now all of that, however, is in a tough budget environment, right? I
Yeah.
mean, choices have to be made. And while we enjoy very bipartisan support, it doesn't float up to the top of many people's list, or there's a lot of other things happening that need to immediately be dealt with. So when you look at impact, it really is funding level. Quite frankly, at one point we were like, do we still have offices of women's health within the federal agencies? Is that a metric? We do. But I think, just really thinking about how do we measure success is interesting. The other piece is, you mentioned earlier, menopause. People are talking about it now, right? We've been working on menopause the entire time we've been here. Our first sort of in the current iteration of our menopause work was back in 2020, which is not, and we were told, quite honestly, by bipartisan members of Congress, none of them will be named, that it was not an issue area that they were going to take up because it was a personal issue. And then cut to 2023, 24, 25, everybody wants to talk about it. So
Yeah.
I think it's really thinking about the conversation. I mean, and I would say one measure of our success too is how many more amazing women's health companies, startups. You look at femtech, you look at just this. I mean, even we were just talking about coming from JP Morgan, the sheer volume of women's health reports and conversations happening right now. I think that's a success for all of us. So, aside from the how many people are we reaching, are people using our toolkits and our guides, which they are, we measure that, of course, too, to look at success, dissemination, and all of that. But policy can be quite soft to try to measure. And some of it is like, are we still here and are we still moving? And people we're still having these conversations. Some years are better than others in terms of moving the needle forward. But I do think, what one year, like I said, you had a White House initiative, you have a president calling for a huge amount of money on Congress, which didn't actually happen. I mean, we were able to get almost $1 billion, I think, into that. But the next year, it might really be like, were we able to get these bills still introduced? Were we able to have these conversations with members of Congress? Did we create a couple of toolkits that didn't exist otherwise? Were we able
Yeah.
to collaborate? Those types of
I
things.
have a couple of questions. You bring up so many interesting topics. First, with your toolkit specifically, menopause in the workplace. This is, something that I'm just seeing pop up everywhere. The Menopause Society, insurance companies, lots of different women's health companies. I know that your organization has one. Do they differ significantly? Like, what makes some of them unique, and why do we keep reinventing that
Yeah.
wheel?
Yeah, agreed, right? That's a huge issue, and we want to make sure that people aren't hearing different sides of the coin. I would say I feel like the purpose of the guides that are currently out there are a little bit different. And you look
Yeah.
at the Menopause Society, they're really clinicians and they're helping to sort of think about that side of things. Ours is really more like, how do you start this conversation? And I think our best advice for people looking to provide benefits or services for women who are in the menopause transition in the workplace is to simply just identify what what you already have as a benefit, and can it be applied to this population,
Mhm.
rather than, okay, great, let's, have something that's super menopause friendly, which I think is wonderful. We want people to assess how they're doing. But I think for the health of women everywhere, it really needs to sort of go across that continuum. So that is another issue too. It's funny because when we first started getting into it, we had a survey, and then we finally get to the guide and you're like, oh, now there are other people doing this. So how do we really make sure we're supporting one another so that it's not confusing to people too, right? And you don't want to throw a whole bunch of things out there for companies to try to implement. And the last thing anybody would want, I would think, is to not have their content be useful. But yeah, it's been interesting.
Absolutely.
It has led to too, like when I do sort of a road show on menopause in the workplace and try to make the case that, like, yes, this is important. This is a life stage. So yes, women may or may not want to be treated for their symptoms, but you have to think about what's happening during that life stage? And what does it mean for chronic conditions? Or do you have a significant population with autoimmune conditions or endometriosis, which, think about women holistically versus just, okay, this is what we have for our maternity leave policy. This is how we're dealing with fertility, and here's how we're dealing with
The
menopause.
dreaded point solution
I
discussion.
know, right,
Well,
right.
a lot of it is also, honestly, to save money. So they want to keep their workforce
Yeah.
working and whatnot. Question two, because of course this was huge news in my world, was the, alteration of the black box warning on hormone therapy, both local, which was sort of expected, and systemic, which was a bit of a shock to some of us. Were you and your organization part of this? Did you spearhead any of this? Were you part of this movement?
So we were there when they announced it, which was really exciting. And it's
Yeah.
something that, I mean, anyone who's in the space, we all know for 20, since the black box went on,
Yeah.
we've all been trying to reverse it. And I think you're right, it is interesting. Like that distinction between local, which everyone agrees on, and
Yes.
systemic, which
Well,
I think we
yes.
sort of as, okay, well, they're going above and beyond in many ways.
Well,
But
actually, it was very
it's a little
jarring
tricky.
for the medical
There were
community.
many different opinions in the room, right? When we
There
think about
were.
it.
To
Yeah.
me, it just going to keep me in business because I feel like, there's now an awful lot to be explained to individuals for their individual needs.
Yeah.
But I just wondered how difficult that was. How long has it been going
I
on?
mean, 20 years,
Yeah.
right? So, and that's, I think, it's interesting too. It is indicative, I think, of how long it takes to change policy. And so I think overall it's so funny too, and went sort of like behind how the sausage is made, we had three different statements ready to go because we
Yeah.
weren't told. I think we thought we knew. I was like, we're fairly certain that they're going to remove it for, local. They could go beyond. And so we want to be ready for that. And we really focused on this is a great starting point.
Hmm.
We've wanted this removed. It didn't reflect the data at the time. It doesn't reflect data now. And let's use this as an opportunity to really allow for conversations with your healthcare providers, shared
Yeah.
decision making, and continued conversation with policymakers about what good looks like. And so I
Yeah.
think but it is confusing, just like the Women's Health Initiative overnight was confusing for women. The interesting thing now with social media, I do think, or I would hope, is that given the conversation for patients at least, right? Like there are opportunities to learn more, but we always are telling, sort of our constituency, read the data, read the papers, go talk with your clinician and
Yeah.
engage in that shared decision making because you're like with anything you're going to hear, and especially with this, you're going to hear a lot of differing opinions. And you're right, it was a little bit of a surprise that they went that far.
I am very interested to see how quickly we're able to measure the uptake of hormone therapy now because, for so long it really remained very steadily quite low at about 4% of people taking it who would be candidates for it. So I am waiting, but I guess I won't hold my breath for that one.
I mean, I think the implementation also is going to take a long time, right? Like the
Yes,
announcement came, but then, and
the
this is
label
super
hasn't
wonky. Yeah,
changed.
the
Yeah,
label hasn't changed because that's actually not owned by
yeah,
FDA. The drug sponsor has to do it, and they're committed to doing it. It takes a long time. And
it
So,
so,
sure does.
Katie, you had mentioned and policy and regulatory change and all of these issues that you tackle, including the actual content topics of women's health and certain diseases, are so complex. You mentioned constituents, and I imagine that there are a lot of different groups that fall under that category. Who do you
Yeah.
consider your primary constituents for the work that you do?
yeah, that is also a good question. And we sort of bucket our materials by audience, if you will. So we do have the members of the public, of course. And that's really our general patient, sort of patient facing deliverables. Policymakers are another one. We have position statements, we have policy agendas. We really focus on federal policy and think about how we can close the research gap that way. And then I would add sort of clinicians and researchers as another sort of leg of the stool because what we really want is we use those experts who volunteer their time as part of our working group to inform the work that we do. But we want to get to your primary care, your general nurse practitioners who are sort of that first interaction. And maybe, and I sort of keep coming back to lupus because I think it's a good example, right? Like you could have a patient present, and if at least they think, oh, could this be lupus? That would be a huge win. And so you're right, it is a lot of constituencies, if you will. We do our best to tailor everything to those. And so we have those like really distinct work. I would say now, as we think about the current environment, sort of it's legacy and foundational for us, but it is something that as we're building out our next iteration of our strategic plan, which is starting like now, how do we pull all of this together, right? Like what do the activities look like to really close that women's health gap? And how are we advocating for more research? How are we making sure that that research is being disseminated? How does that change clinical practice? And then what do women know to be empowered in their care? So that, and is there a policy lever that we can pull?
I love that. That's a great way to
Yeah.
bring it all together. I mean, there was so much information at JP Morgan, which we were both just at this past week. But one of the themes that came out for me, the thing that gets repeated over and over again, was really the difference between health span and lifespan. So
Yes.
we know women are living longer, but they're not living longer healthier. And so that's one of the themes that have come out. But what you've really helped laid out and help people understand, I hope, is there are a lot of levers. Just like when Alyssa is treating a patient, there are a lot of levers, there are a lot of systems at play. Not only is women's health care delivery complicated, fixing the systemic
Oh,
challenges
yeah.
fixing the challenges is also a very complicated undertaking. So thank you for all the work that you're doing.
Oh my gosh. Thank you all. I mean, just the fact that these conversations are happening more often, and I know we've all been doing this for a really long time. It's been really a wonderful community. And I think because I was so focused on maternal health, being welcomed into sort of the broader women's health community has been really wonderful.
Women's health, I think now is like Hotel California. Well, thank you so much. We really
Great
appreciate
to
your
speak.
time and, of course, all the great work you're doing.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.